All right, looks like we're live.
Well, good evening, everyone. It is a Monday, the 19th of April, 2021. And on this day, I will call to order our City of Racine Common Council, the hour of 6 o'clock, having arrived on this special meeting and final meeting of the outgoing council. The first order of business after the call to order is the Pledge of Allegiance to the flag. If I could ask everyone to please join me in rising and facing the east and reciting the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Alder Tate, are there any excused absences for this evening?
Thank you. Alder West and Alder Mi'kmaq have requested to be excused.
Duly noted, and it will be added to the minutes as such. Moving on, then we have the approval of the council proceedings or the minutes from March the 16th and March the 25th.
So
at this
moved.
time, I would enter a motion to approve both sets of minutes. A motion from Alder Coe. Second from Alder Tate the second. Any discussion on said minutes? Seeing none, if everyone could please unmute themselves briefly. And then I would simply ask all those in favor of the minutes of March the 16th and 25th of 2021, please say aye.
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 Opposed? That motion carries. So we will start tonight. And we actually wanted to do this at the beginning of our conversation today because we have a robust agenda and wanted to give it ample time. But we have, unfortunately, two outgoing alders who have decided not to run for re-election, and we will no doubt still be served well by their successors. But we are sad to see both Alders Levy and Alder Land at their final meeting of their tenure on the city council as alders for the city of Racine. It has been really a pleasure to work with both of you. You've been fantastic advocates for your constituents, for working class people, for issues that draw us all to public service to try to lift people up into the middle class and give everybody a fair shot, regardless of their background. And so, you know, we will miss your voices deeply as we move forward. I wanted to give both of you an opportunity, if you so desired, to say a few words at the start of your final meeting of the Common Council. And we will go by seniority, and I will first call on Alder Land to see if she would like to say a few words. Mary?
Yes, I would. Thank you so much. First of all, I'd like to thank the people of the 11th District for entrusting me as their representative for the last 6 years. It's been my pleasure to serve you. And I'd like to thank my family for always putting up with my absences and, you know, working around my schedules. Without their support, I couldn't have done it either. I'd like to thank all the people who were so helpful to me especially when I first became an alder. And I have to mention two of them that have passed that were a great help to me, the late, great Ray DeHaan and the late, great Dennis Weiser. They were so helpful to me when I started, along with so many other people. I couldn't even name them all, including my the alderman before me, Greg Helding, a huge help to me. And it really is a learning curve. So it's really good when you have people so willing to help you. I would like to thank the city staff, who I think is just superb. I mean, they're so knowledgeable, so helpful. Whenever I needed help with any problem, big or small, we worked through it, and I can't thank you enough. All of you are always going to be in my heart. Thank you to my jack of all trades. You know who you are, Shannon. Okay, and most of all, and also all my fellow alders. I'm going to miss you guys so much. Mayor Mason, all you alders, I really feel sad that I can't be in there with you today in person, that we're on a Zoom meeting, but after this thing passes, I hope we can all get together, have a little celebration. I still am going to be here I still love the city of Racine, and if I'm needed for anything, please call on me. All right, thank you.
Alderland, bravo, and thank you very much. And thank you for ending with that, because there's still a number of committee appointments that I may ask you to chime in on. Without any further ado, I also then now want to turn it over to Alder Levy, who has been a pleasure to serve with as well, and ask her to say a few remarks on this for outgoing meeting of the City Council. Jen?
Thank you, Mayor Mason. I really appreciate the opportunity. First, I want to thank all of the constituents of the 5th District for electing me to represent them. It's been an honor to serve them here on Common Council. Even though I am only serving one term, I've learned so much, and it's been an honor to serve the residents in the 5th District. I want to thank my friends and family who supported me through this first term. I also want to thank all of the alders that I've served with. I really respect all of you and the leadership that you provide for your constituents. I also want to thank Mayor Mason and his entire staff. It's really phenomenal. All of the staff in every single department of this city are exceptional. I've had so much support from each and every one of those staff members that I've reached out to on a regular basis. I have the utmost respect for the staff of this city. And I want to reiterate that even though I am no longer going to serve on the Common Council, I too will continue to support this city, and in whatever capacity I'm needed, I'm happy to help in any way possible. This is an incredible city with incredible residents, and I know with the continued leadership of Mayor Mason and the Common Council that we are in good hands, and I look forward to the important work that lies ahead for everyone on the Common Council. So thank you again for this opportunity. I also want to mention too that I'm really pleased that Alder Melissa Caprellian will be stepping in. I'm pleased she was elected to represent the 5th District. I know she'll do an exceptional job. So thanks again, everyone.
Alder Levy, thank you very much. Alderland, did you want to say just one more thing?
I forgot to welcome Alder CJ Rouse and wish him the best of luck. I did forget that, sorry. Best of luck, new Alder CJ Rouse, and you can call on me anytime you need help with anything. All right, thank you.
Well, thank you both very much. Alderland, you had mentioned that, I mean, just really, I can't wait till COVID is over and we can all get together in person to give you both a proper send off. I hope that is sooner rather than later, but it is certainly bittersweet for this to be your outgoing meeting, but it is, I wish we could all be together in person. I mean, Zoom is great for conducting the business of the meeting at hand, but it is not a substitute for actual human interaction. So I'm sorry to not be able to do this in person tonight, but we will make a point to invite you both back when it's safe to be back in the building. The next item on the agenda is a proclamation regarding Earth Day. And so I will read that proclamation now. I just want to mention a couple things about Earth Day. As many of you know, Earth Day was founded by a Wisconsin U.S. Senator by the name of Gaylord Nelson some 51 years ago this year. And he really, I've had the opportunity to look back at some of his speeches before that first Earth Day, and I've just been found it remarkable how much, as we sort of talk about intersectionality between environmental justice and the work that needs to be done to include everybody around the crisis of climate and sustainability, how from the very start he was talking about it in those broad terms. And so really pleased to read this proclamation into the record today. So whereas concerned about the deteriorating state of the environment, Wisconsin Senator Gaylord Nelson announced Teach-Ins, renamed Earth Day, on college campuses across the nation to be held on April 22nd, 1970. And whereas in 1990, Senator Nelson was awarded the Presidential Medal of Freedom as Earth Day founder by President Bill Clinton. And whereas in 2018, the City of Racine Common Council approved signing on to the Paris Climate Accord, whereas in 2019, the city established the position of Sustainability and Conservation Coordinator to focus on finding ways for the city to reduce its carbon levels and use renewable resources. And whereas in 2020, the City of Racine installed the largest solar array to date at the Olson Prairie Park in partnership with We Energy's Solar Now project. And whereas the City of Racine is in the process of replacing its diesel-fueled bus fleet with electric buses with a goal of having an all-electric fleet by 2030. And whereas in the face of a global pandemic, we are reminded of the importance of maintaining a clean and healthy environment. That the residents of Racine have a right to live in a sustainable community that provides economic growth and opportunity. Whereas the City of Racine will continue leading sustainability efforts through an environmental justice lens to improve the quality of life for generations to come. Now, therefore, I, Corey Mason, Mayor of the City of Racine, proclaim April 22nd, 2021, Earth Day for the City of Racine. A witness thereof, I have set unto my hand and caused the seal of the city to be affixed. So thank you, everyone, for that. Just as a reminder, Thursday is Earth Day, and we've had a remarkable opportunity to think about the climate in broad terms in the last year. And so would encourage people's participation. Usually we'll be talking about events that we might do on Earth Day. It's going to be a little bit more virtual this year, but I would still encourage everyone to continue to think about those things. So moving on now to the committee reports, we have a direct referral to begin with. This is a communication sponsored by myself, proposing that section 5435 of the Racine Code of Ordinances, the wearing of face coverings, be amended, and that ordinance 0005-21 be adopted as attached. Also requesting a presentation from Health Administrator Bowersox on the mask ordinance and COVID-19. I believe Dottie K. Bowersox is with us virtually. Dottie K, are you there? There
Can
we
you
go.
hear me?
We can hear you. We can hear you, yes. And so, Dottie K, we will hand the presentation over to you regarding COVID-19 and the amendment of our mask ordinance.
Oh, thank you, Mayor Mason, and council members, thank you. I appreciate this opportunity. Alder Land and Alder Levy, you will be missed. So you have been wonderful advocates for the city, as well for the Public Health Department. So on behalf of the Public Health Department, I thank you very much. What we're asking tonight is that we have 4 recommendations for alterations within the ordinance. I have Cody Pierce here. Cody is our epidemiologist. In the back, I have Bobby Fergus, who's the Director of Community Health, and off to the side, I have Stephen Curtis, and Stephen is the coordinator of our laboratory services and also our safety officer. So any questions that you have this evening concerning this matter, we'll be delighted to have interaction with you and answer your questions. We're going to start off with Cody Pierce, again, the epidemiologist for the Health Department. Cody has some numbers and some statistics in relationship to COVID that he would like to share with you.
All right, thanks, Dottie K. Good evening, everybody. So just a quick update on the city's status in terms of COVID cases and vaccination. So as of today, we are sitting at a total of 8,540 confirmed cases of COVID. That's an increase of 94 cases in the last week. And while that may not sound like a lot in comparison to the overall number of cases, that's an increase that's almost 3 times as much as what we saw a month ago, where we saw just 27 cases in a 7-day period back in March. Our case rate, which is a way to compare kind of case activity or disease activity across the jurisdiction, is currently at 224 cases per 100,000 individuals over the last 14 days. That's an increase of from 70 cases per 100,000 individuals back on March 19th, so more than 3 times the increase there as well. And our current case positivity, or test positivity rather, is sitting at 14% right now. So 14% of those people testing are coming back positive. And a quick update on vaccination status. Currently, the state of Wisconsin has about 40.2% of residents with at least 1 dose received of the vaccine. Racine County has 36.9% of residents with at least 1 dose of the COVID-19 vaccine. And in comparison, the city of Racine, or our jurisdiction, has 29.7% of residents that have received at least 1 dose of vaccine. Comparing that, just 19.3% of city residents have currently been completely vaccinated for COVID vaccine. So that would be 2 doses of either the Pfizer or Moderna vaccine or 1 dose of the Johnson & Johnson.
Okay, all right, thank you, Cody. So this evening, the recommendations, the alterations, we have 4 of them within the ordinance. City Attorney Letney has been kind enough, again this afternoon, to send out the differences and the ordinance in its complete. Shannon was kind enough, Shannon Powell was kind enough to do a press release and send that information out last week as well. But the first thing we're looking at is to be removed within the definition of face coverings, to remove bandana, scarves, and gaiters. We will continue with the medical masks and cloth masks. We just want to make sure that individuals understand that those are the preference that have been recommended by the CDC. The next alteration has to do with school cafeterias. They're added to the list of establishments offering or permitting food service, providing an exception of wearing the mask during the time in which individuals are eating. The third one is that masks will be required in government facilities, institutions of higher education, public-private kindergarten through 12th grade schools, and in licensed child care and youth facilities. So the governor's order, mask order, covered all of that. This order ordinance was done in July of last year, and so, but with the governor, they covered that. So now again, an amendment to that. And the last one is an exception to wearing face coverings is added for persons giving religious, political, media, artistic, cultural, musical, theatrical, or other public presentations for an audience when actively speaking or performing. And again, the note on that, or the caveat, is that it applies to 1 person or 2 persons if they reside in the same household, and then again, maintaining that 6-foot distance. So those, again, are the 4 recommendations, the 4 alterations to the current mask ordinance that we're recommending, along with that note for the last recommendation. So at this time, we'd be delighted to take any questions that you may have on any of those or any other items in relationship to COVID.
So Alder Tate II has a question.
Thank you, Director Fisher, for the presentation, as well as to your staff for continuing to kind of stay ahead of kind of the curve, for lack of a better term, and try and keep the community safe. One of my questions relates to vaccination as well as case rates. And as we kind of, at least optimistically, get to the tail end of this pandemic, what are some benchmarks that we should be sharing, or at least that the community might benefit from knowing, in terms of how do we get more to normal, whether that's vaccination rates, case rates, or some combination thereof? Like, where do we need to be in order for us to be in a safe place to resume certain activities that people are really used to and perhaps looking forward to, especially in this year?
Yeah, oh, excellent question, Alder, and thank you. So one of the things is that the vaccination rate needs to increase. So it just needs to increase. Individuals need to get vaccinated. We have over 200 appointments available right now this week at Festival Hall. Many of the other organizations within the city of Racine have appointment availability, and we're asking individuals to get vaccinated. At Festival Hall, we are using the Pfizer vaccine, which is a 2-dose vaccine. At the same point, in order for us to get control of this, we need to be vaccinated. Now, to augment that, we need to wear masks. We need to keep this physical or the social distancing, the 6-foot minimal. We need to stay home when we're ill. We need to get tested if we're symptomatic or have been in contact with those individuals that have tested positive. So just because you're vaccinated doesn't mean that you can't contract COVID. You will do at a much less, but there's still a 10 to 15% chance. So that's why the masks are so important in the distancing. Hand washing, hand sanitizing, the same sort of things that we've been looking at previously. Just a few weeks ago, we were at a 5% positivity rate, 5%. We were jumping up and down and having a great day. So it was a really good thing. And now we're seeing this increase. So I know it's possible just by what we're doing and how we've been doing it. It's very possible. But again, we need to be diligent. The pandemic is not over with. If you take a look, there's 34 states right now that are in acceleration mode of COVID. And it's in the Midwest. 2 weeks ago, we were not one of the states. Now we are one of the states. So again, we need to be diligent about our actions and interactions.
Thank you. And as a follow-up, can you speak to a little bit the role of variance in all of these changes and how that changes or doesn't change kind of our approach, or how it demands more vigilance as it affects different groups differently than previously kind of the base COVID was in the last year?
Oh, yes, certainly. So as projected, the British strain of COVID is the predominant strain at this point in the United States. It was projected in the month of March that would happen, and it has. It is more contagious, and it's hitting a younger population than what the previous dominant strain of COVID has been. At the same point, we have the strain in Brazil. Brazil right now is having a very, very difficult time with the number of cases, the number of deaths, and the transmission. We still have the variant in Africa. India is having another very difficult time. We've got some of the European countries that again are having a difficult time. But again, those strains, as they change, we need to be conscientious that they're different than the original strain of COVID, or potentially are different than the original strain of COVID. And again, with the British strain, it's more contagious and it's affecting younger individuals more often than what we've seen previously.
Great question, Alder Tate II. Thank you very much. Next, let's go to Alder Coe. Alder Coe, you're muted.
So I got a question. Are we saying we're banning these gator masks and ties around the face?
Good question, Alder. Thank you. No, not banning them, just not recommending them. So they're being deleted out of the ordinance. They don't fit the face well. There's gaps. They just, they're not recommended. So we're not banning them, but we're just not recommending them.
Well, the reason I'm asking this is there's a lot of companies and a lot of people working in factories are wearing these gaiters, and there's a lot of people also wearing the bandanas. And my concern is if we're saying you can't wear these things, we're going to have more people not wearing any kind of face covering. So that was
I understand, Alder.
That was my concern. I mean, I'm okay with this, except, as long as we're not going to punish people for wearing things.
No.
All right. Thank you.
Yep.
I appreciate it.
Alder Coe, that was a good clarification. Thank you very much. Alder Peterson.
Yes, 2 quick questions. One, are we lagging behind the county in vaccinations because of lack of vaccines or lack of people signing up? And 2, are we seeing a drop in hospitalizations as a result of some of the more at-risk people choosing to get vaccinated?
2 great questions. Dottie K, can you try to take both those on?
Yes, we are not lacking vaccine at this point. As I mentioned, we've got over 200 appointments that are available right now. Many of the other organizations in the community that are vaccinating also have appointment availability, so it's not for the lack of vaccine. Last week was a difficult week with the pause in the J&J vaccine. A lot of misconceptions about that and why it happened and how it happened. So we had a lot of cancellations. We had a lot of no-shows for individuals at clinic last week. So we're hoping within the next week, the next 2 weeks, that those numbers will again pick up. So, but the entire state of Wisconsin saw a drop this last week in the number of individuals that were vaccinated, and a significant drop. So again, we're hoping that, with this pause, as we continue forward and more information is put forth by the CDC and the federal government about the vaccine, that individuals will reconsider their decision and get vaccinated. The hospitalizations, with both, as I understand, Advocate and Ascension are doing well. The last information I had is that they were within their census. And that's all the information I have on that.
Okay, a follow-up on the first question.
Sure, go ahead, Alder Peterson.
I don't mean to make extra work for you. I really don't. I know you've been working very hard for 14 months, and I appreciate it. Have you looked at going to different community centers to try and hit the underserved and those with transportation problems or those with communication problems?
Uh-huh. Oh,
Alder Peterson, that's a great question. Dottie K, can you talk a little bit about sort of where we are with both outreach and then overcoming vaccine hesitancy? I mean, really, Alder Peterson, there's really two things going on at the same time here. There is meeting people where they are. And then, we've sort of hit the place where there is more supply than there is demand at this point, and sort of educating people to get over their hesitancy. Dottie K, can you talk a little bit about the specifics of where we're looking to maybe expand operations?
yes, and thank you, Mary, and yes, thank you, Alder. Yes, as a matter of fact, we've made a request to the state mobile vaccination team for two sites, two additional sites here in the city of Racine, one at Tyler Domer and the other at the Martin Luther King Community Center. For the first 2 weeks in the month of March, and then potentially, if there's good response, continuing through the month of March for that team to be here. The
Kate,
health
you mean the
department
month
just
of May?
Or month of May. Did I say March? Oh, sorry,
Yes.
guys. Sorry. Yeah, sorry. But the month of May. Yes, thank you. But the month of May. So this department is responsible for the logistics. And at the same point, the state will be providing individuals to help with the facilitation of the paperwork and such, and then a vaccinator, and then we'll supply another vaccinator. So the finalization of all those, of them being here and such, are going to happen hopefully this week. We have another meeting with them, and we'll be able to finalize all the specifics on that. But we're looking for the first 2 weeks in May and potentially continuing thereafter.
Thank you very much.
Alder Peterson, thank you for your questions. Alder Perez.
Thank you, Your Honor. And thank you, Dottie, for the great work you're doing. Why were the other alternative masks not recommended anymore? What's going on with that? Have we been finding out that they're not as effective, or what's going on?
Dottie K.
Yeah. Oh, thank you, Alder. Yes, the recommendations is that the mask fits snugly over the bridge of the nose, along the side of the face, underneath the chin, and that it fits well. The gaiters, the kerchiefs, the bandanas and such have a tendency to cover more of the neck sometimes than the face. They're open on the sides. They kind of flap. They're not an enclosed face mask or cloth mask sitting close to the face.
Alder Perez, did you have a follow-up question or no? Okay. Alder Lemke, and then I see Alder Pete has his hand raised. I'll get to you, Alder Pete, right after Alder Lemke. Alder Lemke?
Thanks. There's so many good questions tonight. I would like to ask, I had a few questions because today that we're amending the ordinance to say that we're recommending to include the schools as a food service location. And I think some folks had questions about what the recommendations were for schools masking versus school cafeterias. Could you clarify that a little?
Dottie K?
Yes, oh, thank you, Mayor. Yes, the cafeteria we were is like a restaurant, for example. So those individuals that maintain the distance and such, while they're eating and consuming and drinking their beverages and food products, yeah, they take the mask off as long as they're continuing with the distancing.
Okay. And then can you just share the overall guidelines for schools regarding masks still, just from the 10,000-foot view?
Sure. Cody, do you want to do that?
Sure. So the guidance there hasn't really changed in that mask usage should still continue in schools, unless there's an activity going on that would prevent mask usage. Otherwise, in the regular classroom setting, hallways, things like that, masks should be continued to use. Yeah, for anyone 4 years or older, or, for whom masks are approved and who wouldn't approve some sort of physical or health concern.
Thank you. I appreciate that. I think there was just some confusion because school cafeterias were changing. And I just wanted to let folks know that schools overall haven't had their recommendations changed. So thank you.
Thank you, Alder Lemke. That's an important clarification. Alder Pete?
Yes, thank you, Mayor. Thank you, Dottie. Had a question about what we're doing, or the health department is doing, to make young people 16 plus aware that they should and can be vaccinated. Obviously, it's very important with the variant affecting younger people more so than the other strands. So are we have programs and policies in place, advertising, public relations, et cetera, to reach out to the 16 plus age group?
Daddy K. Bowersox, can you respond?
Thank you.
Bobby, do you want to say something? Sure. Come up here.
Thank you, Alder, for the question. So we have been in contact with our schools, just giving them information that can be sent home to the parents. Our protocol at the health department, we do have to have parental consent, so we ask that a parent come with their child so that they are available to sign for them, they understand the consent, and they get education on the vaccine that their child is receiving. So at this time, the state is looking at doing additional awareness to get across to students, especially as the vaccine may become available to younger students. So we are in the process, along with the other mobile vaccination teams, to get the students vaccinated.
Okay, great. Thanks. Alder Perez, do you have another question?
Yes, Your Honor.
Please proceed.
Thank you. Ms. Bowersox mentioned anything related to this, and I was wondering if you could go over the change for the churches that happened recently. I had several churches call me, and I wanted to make sure that they understood the information change for the churches correctly.
Daddy K. Bowersox, can you respond to that question?
Sure. Yeah, and thank you, Alder. Yes, and for specific details, I'll defer to the City Attorney Letney. He was the one who crafted the language and such. But basically, within the framework of the Supreme Court decision, so within the churches right now, it's the mass gatherings of 200. But with that decision, the percent as far as who can be in the church was removed.
Okay, so
Yeah.
there's no
Yeah.
there's no percentage anybody can go as long as they can maintain distancing and wear a mask. Is that how that works?
Yes, yes, and again, I don't know if City Attorney Letney is on the line.
I don't know if the city attorney, let me hang on just a second. Daddy K, let me see if we can't make him, he's on there as an attendee. If we could make him a panelist, that would be great. Attorney Letney, are you there?
I am, Mr. Mayor.
Great. Do you want to offer any clarification to Alder Perez's question?
Sure. The basic capacity limits for any faith-based institution, a church, have been removed just to make sure the city is consistent with what the United States Supreme Court has determined the relevant law is. So while the special events restriction remains the same as special events across the city, there are no capacity limits with regard to whom and how many attend services.
Oh. Okay, thank you.
Thank you for your question, Alder Perez. Alder Taft.
Thank you. I'm sorry, I may have missed, I'm having internet trouble this evening, so if I ask a question that was already asked, I apologize. I know I heard the Administrator Bowersox speak about the variants, and I guess I wanted more information specifically about younger kids, and if you addressed that already, my apologies. And I also wanted to ask how the hospitals were doing in terms of with the rise in cases, and that those were two questions that I had. I don't know if they've been asked already.
Do you want to try this one again, or do you want me to? Oh, yes, and Alder, thank you very much. So again, the variants that we're seeing as far as the predominant variants in the United States at this point is the British. So it has a tendency to be more contagious and hit a younger population than the previous strain of COVID. So at the same time, we have the Brazilian variant, which Brazil is having significant difficulties with the COVID, the transmission, the number of deaths, the number of hospitalizations and such. We still have the variant in Africa, India, several countries in Europe, are seeing significant increases, again, with different variants. But in particular, the British variant is the dominant one in the United States right now. I haven't seen any projections on how long they think that's going to last, and or if it's going to be modified and or replaced by one of the other variants. But at this point, that's where we're at, and we have seen that variant in the state of Wisconsin.
So I guess I asked the question because I think there's a perception out there that somehow younger kids, especially elementary school kids, but kids in general, are somehow not going to get the virus or not in danger of the virus. So I guess I'm specifically asking for clarification on adolescents and kids, because because I think that's a perception. I don't know if it's accurate.
Yeah, and it's been very difficult. The changes that we have within the information on the pandemic has changed sometimes hourly. And we're still learning, and we're still trying to understand the scope and the depth of the COVID virus. It's very difficult. At the same point, what I do know is that the testing, if you remember, months and months ago, we couldn't get tested. So there wasn't enough supplies, enough facilities and such, and they were geared toward adults being tested. So during the course of this pandemic, children were not on the radar to be tested. We were looking at the elderly, we were looking at older individuals, we were looking at middle-aged individuals, we weren't necessarily looking at children. We do know that with children, as well as with adults, that they may be non-symptomatic. That doesn't mean, it means that they still can transmit the virus, but they won't have the symptoms or severe symptoms as someone else. But at this point, the information that we have is that children can acquire COVID. And we have seen with this new strain across the country where more children are becoming ill.
Well, thank you for that. I appreciate that. I mean, that's how science works. It changes with new information. And also, I just wanted to ask about the hospitals. So my impression is that local hospitals are doing okay, but my impression is too that if we hit further benchmarks, we may have to take additional measures, right? Because we've kind of eased off because of data, and the data might change. But can you give an update on the hospital situation?
Yeah, the last report that I had on the hospitals is that they were doing well. So, but again, that's where we want them to be.
Yeah.
So our police department, our fire department, our healthcare systems, and our public health departments are all finite resources. Once we hit capacity, we don't have a lot of maneuverability. And as we've seen with other states and other areas of the state of Wisconsin, that calling in for mutual aid is not necessarily always an option because they may be in crisis mode as well, from whomever we're having a discussion with or asking for assistance. So public health departments, for example, across the state, we haven't been able to assist each other because we're barely holding on to each one of our jurisdictions. So that's why it's so important for individuals to get vaccinated. I can say that 150 times and that will not be enough. But the vaccine, getting vaccinated is just really, really important, as well as the precautions that we've been utilizing for the last 14 months with the mask, the distancing, staying home, etc.
Thank you so much.
Thank you. And just, I'm not at all privy to know who amongst us as alders have been vaccinated, but I am told that the council as a group is at 80% vaccination. So bravo to those of you who have, but if you've not yet taken the opportunity to get vaccinated, as Dottie K mentioned, we do have slots available this week. So Alder Jones.
Thank you, Your Honor. This is for Dottie K. I was asked a question: if you've had had the virus and still have antibodies, do you still recommend getting the shot now or waiting?
Yeah, Bobby, you want that one?
Sure.
Yeah.
Alder Jones, thank you for asking that question. We do recommend getting the vaccine now and not waiting. There is, every individual person has a different response to the virus and to the vaccine. So you don't know when you will no longer have antibodies. So we want to make sure that people receive the vaccine if they are eligible. We just ask that people are out of isolation or quarantine before coming to see us.
Thank you.
Thank you, Alder Jones. Alder Perez.
Thank you, Your Honor. Ms. Bowersox, there's been some concerns about mental health and wearing of masks. And can you share any of the science behind the relationship between both of them at this point? Do you have any information that you could share with us?
Yeah, Thank you, Alder. Yes. So we did receive a comment to that effect as well about that concern or about the correlation, if there was a correlation. And we did do some research into that. We weren't able to find anything concrete that indicates that individuals, youth, are negatively impacted by the utilization of masks. And the question that we received was specifically about youth. Now, there is overall stress and anxiety about the pandemic. There's no two ways about that in adults and in children. At the same point, most resources seem to suggest that the use of masks encourages the tuning of development skills. Individuals, children adapting to focusing more on the eyes, body language, and overall tone of the voice and verbal cues versus facial cues and facial gestures. So, but we were not able to find any specific information that said, yes, no mental health concerns with masks, or no, that there are mental health concerns with masks.
What, you've talked about the trends in other places. Do we have any trends specifically here in the city of Racine that you can share with us of what's going on with that?
You mean with masks specifically, Alder Perez, or do you mean with the infection rates of COVID?
Well, both things. That would work. I'd like more information about what's happening locally, if that's available within our city limits or jurisdiction.
Yeah, I think Cody brought up some of that earlier, but it certainly bears repeating. Cody, can you talk a little bit about the infection rates in the last few weeks?
Yeah, thank you for that question. So as I mentioned, our case rate lately is about 224 cases per 100,000 over the last 14 days. That's more than 3 times where we were at a month ago, just 70 cases. And back 2 months ago in mid-February, we were at 105. So case rates have gone up here as well as across the rest of the county and across the rest of the state. And as Sadike has mentioned, we're now one of 34 states that are seeing high activity in COVID once again. Certainly not as high as where we were last fall, but case rates and case activity is much, much higher than it was at the start of this year.
Thank you. One more question, please. We talk about like in the church's capacity and so forth. How does a venue like the zoo get recommended for small capacity of 8% during the day and 3% at night of what it's possible? Why does that work that way when it's an outdoor venue?
Daddy K. Bowersox.
Yeah, and Steph, you want this one? You want to take this one?
It doesn't matter.
Okay, why don't you trade?
Hello, Alders. So in looking at something like the zoo, certainly you could make the argument that given that it's an outdoor facility, and it's got vast amounts of space, that it would be very conducive and safe to, say, do 1,000 or 2,000 individuals. And by comparison, there's other zoos, such as Milwaukee Zoo, that has much higher capacity. I think the challenge you run into in the rationale behind what their existing limits are is that even though it may have lots of space, the attraction itself, what draws people there are to observe the wildlife that is currently being held at the zoo for observation and education. And so that requires people to congregate. And given that 500 people seems like quite a lot, which it is, as you increase those numbers, the risk of having one or more people who are asymptomatic or maybe even symptomatic, and considering the circumstances, could generate a problem if you have, say, a gathering of 1,000 people in which it may become more difficult to distance yourself in those fixed locations that we might otherwise not even consider as being a problem. And then as far as the special events go, the late night, same thing, kind of considering the circumstances that those events may be serving food and drink, as well as congregating a large number of people into not a confined space, but a much smaller space they might not otherwise normally have access to, because the focus is no longer on, say, the tigers, the lions, the rhino, the giraffes, because certainly the argument could be made that they're not active or under observation during that time. So I think the different venues, the activities that are taking place sort of encourage the reduction in the number of participants that may be available on that site, but certainly can understand the inquiry. Does that make sense? As best as I can explain it?
Alder Perez? Great. Okay. Alder Tate the second.
Thank you, Mr. Mayor. I just wanted to follow up about the numbers with Cody potentially. We
Go right
talked
ahead.
about where we're at right now. Can you share what the kind of the high water marks were previously to give some further context in terms of where we are versus where we were 2 months ago? Because I think historically everybody knows like it was really bad at one particular point, and knowing what those numbers were may give people a better sense of which direction we're trending in, or how close we might be trending towards those really challenging moments where we had.
Sure. Yeah, thank you for that question. So our previous high water mark, as you put it, would have been last November. So late fall, early winter, when we were sitting at about 1,600 cases per 14 days. So pretty significantly higher than where we are now. Thankfully, we're not near that point, but there's no saying where this surge that we may be in is going to end. So that's kind of our high mark.
I guess my follow-up, and it's just more of a comment, is part of the reason I think we saw some of that decrease, particularly during the winter, is one, it was winter, so we're not out and about. But two, the high water mark occurred at the kind of heart of our holiday season, and now we're getting ready to enter into spring and a bunch of holidays once again, whether it's Easter or past Easter. But Cinco de Mayo is coming up and a bunch of other events as we enter into summer, and if we can maintain a relatively consistent and low level, I think we have an opportunity to kind of return to some regular activity. But if we're going to continue to trend in that direction, our history, given 2020, tells us that as each holiday comes and we're not doing better, things are going to trend in a significantly worse direction. So just want to encourage folks, please do get vaccinated, because those overall vaccination numbers, including with, I believe, correct me if I'm wrong, Dottie, and others in the health department, but vaccination rates plus current positivity rates all kind of show the current population that may be, let's say, less susceptible to continued exposure, at least for a brief period, particularly for those who are currently active. And that's all considered as we're looking at evaluating how do we do things going forward. Is that correct?
Dottie King?
Yes.
Okay.
Yes.
Thank you. So we don't want the numbers to be a bunch of people have COVID, then another bunch have the vaccine. We'd much rather have a small people might have COVID and a bunch more have the vaccine. But every bit of immunity that exists ultimately helps us. So please get vaccinated and get the good kind as opposed to the bad and temporary and potentially life-threatening kind. Thank you.
Thank you. Alder Peterson?
Yeah, sorry to drag this out. Is there a general transmission? Is there anything in common, or is there what's leading to the increase right now? Is there anything that is a common indicator as to a specific activity that's increasing in numbers? Is there a pinpoint?
Dottie King?
No. Okay, I got it. So, thank you, Alder. Yes, at this point, we've got several venues in which we're continuing to monitor and that we're doing investigation on. We've got some schools, we got childcare facilities, we've got businesses. But I think the bottom line, I mean, it really isn't comprehensively different over the last several months. It's the same sort of venues. It's where individuals are gathering, where individuals are getting together, where individuals are outside of their own home as far as the individuals they're facilitating or they're interacting with. Individuals that may not be wearing a mask, or if they are, they may be wearing it inappropriately. So it's the same sort of trend, shall I say, that we've seen previously.
Okay, so there's no specific hotspot. It's all across the board.
Yes.
Thank you.
Alder, I saw one more hand. I do not see a hand at this moment. Alder, Tate the second. At this time, I would entertain a motion to approve item 0290-21. Communication. Okay, there's a motion to approve that item. Is there a second?
Second.
Move
Second.
to approve.
Thank you. Seconded by Alder Taft. Thank you.
Second.
We've had a good discussion on this, but now on the motion on the amendment to ordinance 0005-21, is there any further discussion? Okay. Seeing none, when the clerk calls your name, please vote as you wish. Clerk Coolidge, could you tell me who the first vote is for the evening?
Sure. Today it was due to be Alder Meekma, but replacing Alder Meekma will be Alder Pete.
Okay, so Alder Pete, you will be first. And then, so when the clerk calls your name, please unmute yourself to vote. And then after you voted, please mute yourself. So unmute to vote and then mute yourself when you're done to avoid the feedback. Again, Clerk Coolidge, please call the roll. When the clerk calls your name, please vote as you wish.
Alder Pete,
Move to approve.
Alder Coe,
Aye.
Alder Jones,
Aye.
Alder Tate,
Aye.
Alder Santiago,
Aye.
Alder Levy,
Aye.
Alder Peterson,
Aye.
Alder Horton,
Aye.
Alder Young,
Aye.
Alder Land,
Aye.
Alder Perez,
No.
Alder Taft,
Aye.
Alder Lemke.
Aye.
That's 12 ayes and 1 no.
Okay. Thank you very much. And I just want to, just before we move on to the next item, I just really want to offer a note of thanks and gratitude to our very hardworking and somewhat beleaguered public health department, who are now in their 14th month of helping us manage their way through this pandemic. I know we've said thank you many times. There are not enough thank yous we can offer, but thank you very much for your stewardship and dedication to public health of our community. Can't say it enough. Thank you. We will now move on to committee reports. The first committee before us is the Finance and Personnel Committee. And so I will turn to Alder Taft. We do have a closed session item to begin with. Alder Taft?
Thank you. Yes, I'm just pulling up. I've been kicked off and kicked out. So I had to re-pull this up. Okay, so we'll start with the closed item. So I do have one item for separate consideration, but I think we should do the closed item first, and then we can start with the separate consideration afterwards. So it is intended that the Common Council will convene in closed session pursuant to Wisconsin statutes, section 19.85(1)(e) to address matters that for competitive or bargaining reasons require a closed session, specifically regarding a tax increment financing agreement with J. Jeffers and Company. So do I read the item now or just move to go into closed session?
You can, Attorney Letney, correct me if I'm wrong, but I think simply making the motion to go into closed session at this point would suffice.
Okay. Then at this time, I will move to go into closed session.
Second.
Second.
There's a second by a motion by Alder Taft to go into closed session, a second by Alder Young. This does require a roll call vote to go into closed session. So when the clerk calls your name, please unmute yourself and vote as you wish.
Alder Pete,
Aye.
Alder Coe,
Aye.
Alder Jones,
Alder Jones?
Forgot to unmute myself. Aye.
Alder Tate,
Aye.
Alder Santiago,
Aye.
Alder Levy,
Aye.
Alder Peterson,
Aye.
Alder Horton,
Aye.
Alder Young,
Aye.
Alder Land,
Aye.
Alder Perez,
Aye.
Alder Taft,
Aye.
Alder Lemke.
Aye.
Motion passes 13-0.
Okay, so we'll go into closed session, which for anybody watching at home means that we will go off of Facebook Live. We will resume the meeting once we are out of closed session, so please watch for that if you'd like to see the remainder of the council proceedings. Annie, if you could take us off of Facebook Live.